So I once again welcome you all to the session on the nutraceutical. Today we are going to discuss herbs as health food, the drug fenugreek. So let us move towards the fenugreek. All of you are aware about the fenugreek. It is also known as the methi, right? And always we are eating its sabji, isn't it? Bhaji, you can say, right? Always it is there in our food, and it is having the potential health benefits. It is known as the fenugreek. So fenugreek is a herb similar to clover. The seed tastes similar to maple syrup and are used in foods and the medicine. There are so many chemical constituents which are present in the fenugreek, which may be helpful to get the health benefits. So fenugreek, it is a dried seeds obtained from Trigonella phonum, belongs to family Fabaceae. The synonyms for the fenugreek are Methi and Medica. See the image which I have placed on the slide, so you will get understood how the fenugreek looks like. I have shown the leaves of the fenugreek along with the seeds and one of the finished product which is available in the market. Let us move towards the chemical constituents of the fenugreek. Why it has been used as a health food? There are so many chemical constituents which are present in the methi seeds and that promotes its acceptance as a nutraceutical. So majorly the fenugreek comprises the fenugreekine, trigonelline, disogenin, then 4-hydroxyisoleucine. These are the major chemical constituents which are present. These are the major chemical constituents which are present in the fenugreek. If we can consider the fresh leaves of the fenugreek or methi contains the ascorbic acid, beta carotene, and the fibers. So you know that the ascorbic acid, it is an antioxidant. Then beta carotene, it is also having some health benefits. Along with it comprises the fibers. Furthermore, it contains the steroids like diosgenin and sapogenin. Other steroids are yamogenin, simalgenin, and sarsapogenin. So these are some of the steroids which are present in the fenugreek. The alkaloids like trigonelline and other trimethylamine, neurine, and choline which are present in the fenugreek. So these are the chemical constituents which are present in the leaves. That is, leaves comprises the certain steroids and the alkaloids. Furthermore, the seed contains the flavonoids like vitexin, trypsin, and quercetin. Apart from the flavonoid, it contains stolone. It is a volatile principle present in the seed. It comprises the amino acid like isoleucine, histidine, and lysine. Then minerals like calcium, magnesium, iron, and potassium. And furthermore, it contains vitamins like thiamine, riboflavin, nicotinic acid, and folic acid. If you can see the seed, the chemical constituents which are present in the seed, mainly it comprises the certain vitamins like thiamine, riboflavin, nicotinic acid, and folic acid. And you know that it is having a certain health benefit. If you can see the minerals, the methi seed comprises the minerals like calcium, magnesium, iron, and potassium. Potassium, it is having a role in the clotting. Then magnesium, calcium, iron, also it is having a certain health benefits. Furthermore, if you can see the certain amino acids which are present in the fenugreek seeds like isoleucine, histidine, and lysine, along with the certain volatile principles like stolone, furanone, and the flavonoid like vitexin, lysine, and quercetin. So these are some of the chemical constituents which are present in the fenugreek, which may lead to the certain health benefits of the fenugreek. So on this slide, we have discussed the biological source of fenugreek. That is, it is dried seeds obtained from the Trigonella funium belonging to family Fabaceae. The synonyms for the fenugreek like medica and methi, and we have discussed the chemical constituents of the fenugreek. Let us move towards the health benefits of the fenugreek. Whatever the health benefits we are getting by using the fenugreek, it is due to the major chemical constituents which are present in it. So fenugreek seed have healthy nutritional profile. See, certain minerals are there, certain vitamins are there, certain flavonoids are present over there, isn't it? And along with this, it comprises the fibers, isn't it? So these are the certain healthy things, nutritional things which are present in the fenugreek. So fenugreek seed have a healthy nutritional profile containing a good amount of fiber, minerals, including the iron and magnesium. And you might know the iron, it is having a great role in the management of the hemoglobin. Furthermore, fenugreek increases the breast milk production and the rate of weight gain in a newborn baby. If you can see, after pregnancy, maybe the fenugreek seed products are given to the pregnant lady, isn't it? The reason behind is that the breast milk production, it is going to be increased. Furthermore, that could be helpful for the weight gain of the newborn baby, right? So that is one of the health benefit in the case of pregnancy, means after pregnancy, right? Fenugreek furthermore boosts the testosterone and estrogen level, and which improves the interest in the sex. So if you can see, the fenugreek seeds, it is having the ability to boost the testosterone levels and estrogen level, and furthermore, it is going to improve the interest in the sex. Then the fenugreek role in the blood sugar control and in the treatment of type 1 and type 2 diabetes. As it comprises the certain fibers, isn't it? They are going to reduce the absorption of the sugar from the stomach. Also, the fenugreek seed, they are going to stimulate the insulin, and thereby it is going to be helpful in the management of the sugar levels in the diabetic patient. That is type 1 diabetes as well as the type 2 diabetes. It is going to promote the insulin secretion. It is going to decrease the absorption of sugar from the stomach. So it is going to be used in the diabetes also. Furthermore, it reduces the fat intake and appetite, which promotes the weight loss. So if you can see the fenugreek in the newborn babies, it is going to be helpful to increase the weight, isn't it? But furthermore, it is going to reduce the fat intake and the appetite, and which promotes the weight loss. That could be helpful in the management of the certain cardiovascular diseases as well as the diabetes mellitus. That is, these are the chronic diseases. Fenugreek can lower the bad cholesterol and the triglycerides level, and that could be helpful in the management of the cardiovascular diseases. It reduces the heartburn. It is going to used as an anti-inflammatory. Then the leaves of the fenugreek are the good hair growth promoter, and it is going to treat the dandruff. If you can see the topical applications of the fenugreek, it is going to promote the hair growth as well as it is going to reduce the dandruff. It inhibits the mammary hyperplasia, hence used to prevent the breast cancer. So whatever the Fenugreek products are there, they are going to inhibit the mammary hyperplasia and hence used to prevent or used to treat the breast cancer. Then Fenugreek is used for the, furthermore, the Fenugreek is used for the menstrual cramps, then sexual problems, then enlarged prostate, then high cholesterol level, obesity, hyperlipidemia, hypercholesterol, ulcer, or upper respiratory tract infection, and arthritis. So these are the certain health benefits of the Fenugreek. The major one, if you can see, it contains the certain nutraceuticals, certain minerals are there, vitamins are present, fibers are present, isn't it? And mainly the iron, magnesium, calcium, and some of the vitamins are there, isn't it? If you can see, it is going to increase the breast milk production, and furthermore, it could be helpful in a weight gain of the newborn baby. It is going to boost the testosterone level and the estrogen level, which could increase the interest in the sex. Furthermore, it is going to manage the blood sugar level. It is going to reduce the absorption of sugar from the stomach, as well as it is going to stimulate the insulin secretion. Then it reduces the fat intake, thereby it is going to be helpful in the obese persons in order to reduce the weight, and that could be helpful in the management of the certain chronic diseases related with the heart and diabetes. Then furthermore, Fenugreek, it is going to reduce the bad cholesterol as well as the triglyceride levels. It is going to reduce the heartburn. Then it is going to act as an anti-inflammatory. Then if we are using the Fenugreek topically, it is going to promote the hair growth, as well as it is going to reduce the dandruff, or it is going to treat the dandruff. It is possible to use the Fenugreek seed oil to treat the dandruff or to promote the growth of hair, isn't it? It is possible to prepare it at home, isn't it? Then it is going to inhibit the mammary hyperplasia, hence used to prevent the breast cancer. And finally, if you can see, in short, Fenugreek, it is used for menstrual cramps, then sexual problems, enlarged prostate, then the high cholesterol levels, then the obesity, hyperlipidemia, hypercholesterol, ulcer, upper respiratory tract infections, and arthritis. So these are some of the major health benefits of the Fenugreek. Well, let us move towards the dosage. So in the case of diabetes, 5 to 100 gram powdered seeds once or twice per or 4 days in a week, continue to 3 years, 1 month, extract per day. So in the case of diabetes, we are using the dose at the rate of 5 to 100 gram powdered seeds once or twice per or 4 days in a week, and it should be continued up to 3 years or the 1 month extract per day. In the case of dysmenorrhea, 1800 to 2700 milligram powdered seeds 3 times daily for first 3 days of a menstruation, followed by 900 milligram 3 times daily for remaining days. So these are the 2 dosage guidelines are given related with the diabetes and dysmenorrhea. Let us see the side effects of the Fenugreek. Oh yes, Fenugreek, it is having so many health benefits, but apart from its health benefits, it is also having the sudden side effects. If you can see the consumption of Fenugreek, it may show the side effects like diarrhea, stomach upset, bloating, and the gas. Furthermore, it causes the numbness, facial swelling, and breathing difficulty. There might be the uterine contraction and hypoglycemia. As you know that the fenugreek can be used to treat it is used to manage the sugar levels in the diabetes. So sometimes there might be chances of hypoglycemia after heavy consumption of the fenugreek seeds. It should be administered cautiously in a patient taking antihypertensive and anti-diabetic medication, isn't it? So whatever the fenugreek products are there, if patient is on a therapy of the certain antihypertensives or the anti-diabetic, there is a precautionary warning is given that may lead to the hypoglycemia, or that may lead to the reduction in the blood pressure, right? Reduction in the sugar levels or reduction in the blood pressure. So these are the certain side effects of the fenugreek. Let's move towards the precautions of the fenugreek. So fenugreek, it should be avoided in a pregnancy, might cause the malformation in the baby. So before pregnancy, whatever the fenugreek is there, it should be avoided. That may lead to the malformation in the baby. In children's, unusual body and urine odor. If the fenugreek product is being consumed by the children, that may lead to the unusual body and urine odor. Then sometimes the fenugreek produces the allergy, and furthermore, the fenugreek might slow the blood clotting. So it might cause extra bleeding during and after surgery. So stop taking the fenugreek at least 2 weeks before scheduled surgery. So these are the certain precautions and warnings are given. So fenugreek should be avoided in the pregnancy. In the case of children, we are getting the unusual body and urine odor. Sometimes it may produce the allergy. Then it is going to reduce the blood clotting. So it should be avoided in the surgery. That is, it should be stopped before surgery, at least 2 weeks before. Let us move towards the drug interactions of the fenugreek. So very first drug interaction, that is a fenugreek and diabetes medication. As you know that the fenugreek, it is going to reduce the blood sugar level. It is having a great role in the management of the diabetes, isn't it? It is going to reduce the absorption of the sugars from the stomach, as well as it is going to promote or stimulate the insulin secretion. If we have combined the fenugreek with the diabetes medications, that might cause decrease in the blood sugar level. That may lead to the hypoglycemia. So one should monitor the blood sugar level. If the patient is on a therapy of anti-diabetic drug and we have started the fenugreek, right? So this is the first drug interaction related with the anti-diabetic medications. The second drug interaction, it is related with the fenugreek and the anticoagulant or antiplatelet drug. The anticoagulant drugs, they are going to prevent the coagulation. They are going to thin the blood. Similarly, the antiplatelet drugs, they are also going to thin the blood. So anticoagulant drug like a warfarin, then the antiplatelet drug like aspirin, ibuprofen, they are going to reduce they are going to thin the blood, isn't it? They are going to act as an anticoagulant or the antiplatelet. So taking a fenugreek along with the anticoagulant or antiplatelet drug, that also slows blood clotting and might increase the risk of bruising and bleeding. As the fenugreek, it is going to slow the blood clotting, isn't it? And anticoagulant as well as the antiplatelet drug, they are also going to slow down the blood clotting. So there might be the synergistic effect, and that may lead to the bleeding in the patient. Then fenugreek might reduce how much theophylline is absorbed. There is one more drug interaction related to the fenugreek and theophylline. Theophylline, it is used in the asthma. It is used to manage the asthmatic attacks. So fenugreek might reduce how much theophylline is absorbed by the body. So when we are combining the fenugreek and theophylline, there might be chances of reduction in the effect of theophylline. So this is a drug interaction related with the absorption. Fenugreek reduces the absorption of theophylline and thereby reduces the absorption of theophylline, and the effects of theophylline going to be reduced, and there might be chances of asthmatic attack. So this is the third drug interaction related with the fenugreek. So that's it about the fenugreek. So in the case of fenugreek, we have discussed the biological source, then the synonym, chemical constituents, then the health benefits of fenugreek, then the side effects, then dosage, then the precautions and the drug interaction.